How do stem cell transplant types impact emotional well-being? Imagine facing a treatment that could change your life, but each option comes with its own emotional landscape. When it comes to stem cell transplants for non-Hodgkin lymphoma, understanding how different types affect your feelings and mental health is key. There are mainly two types of transplants: autologous, which uses your own stem cells, and allogeneic, which involves stem cells from a donor. There is also a less intense option called a mini-transplant or reduced-intensity allogeneic transplant. Each of these can influence your emotional state in unique ways. With an autologous transplant, since your own stem cells are used, the risks are generally lower. This means fewer serious complications like graft-versus-host disease, which can be a source of worry. Because of this, many patients find they experience less emotional distress related to treatment side effects. Still, the process involves high-dose chemotherapy and periods of isolation, which can lead to feelings of anxiety, fatigue, and even depression. Patients often worry about whether the treatment will work or if the cancer might come back, adding ongoing emotional stress. Allogeneic transplants, on the other hand, involve stem cells from a donor. This option carries higher risks, including immune reactions like graft-versus-host disease and other complications. The possibility of serious side effects and a longer recovery can make patients feel more anxious or vulnerable. The process of finding a suitable donor can also be stressful, and fears about transplant rejection or failure may persist. The need for lifelong medications to suppress the immune system can add to feelings of uncertainty and emotional strain. The mini-transplant offers a middle ground. It uses lower doses of chemotherapy or radiation, which means fewer immediate side effects and risks. Patients who are older or have other health issues often choose this route. Because it is less aggressive, some emotional burdens related to physical side effects may be reduced. However, the uncertainty about how well the treatment will work and the potential for complications still exist, so emotional support remains important. Across all transplant types, the emotional experience is influenced by factors like hospitalization, isolation, and changes in appearance or energy levels. Feelings of loneliness or social disconnection can be common. The fear of relapse and worries about health can also weigh heavily. Physical side effects such as fatigue or pain can impact mood and self-esteem. Support from healthcare teams, mental health professionals, family, and friends plays a vital role in helping patients cope emotionally. Remember, each person's emotional response is unique, shaped by resilience, social support, and mental health history. In summary, autologous transplants tend to involve fewer emotional challenges related to physical risks, but the emotional toll of treatment and uncertainty remains. Allogeneic transplants often bring higher physical risks that can lead to greater emotional distress. The mini-transplant offers a gentler approach that may ease some emotional burdens but still requires psychological support. For anyone considering these options, understanding these emotional impacts can help prepare for the journey ahead. Always consult healthcare professionals for personalized advice, as individual experiences can vary widely.